Hello, and welcome to the Ascend Health Show. I'm Nick Angelis. I'm the owner of Ascend Health Center and a nurse anesthetist. And I'm here with licensed independent social worker Amanda Kostura from Carve Your Own Path.
Hey, Nick. Nice to see you again.
I almost put like the supervisor, like since it's in your title.
I know.
Yeah.
It's hard to say it. And then I'm like, with supervision designation. And then people are like, what does that mean? And I'm like, just never mind. I'm a social work supervisor.
Yeah, just let me know if you need
They're like, what are all these letters? I'm like, nobody knows. It's fine. You go to another state and it's going to be totally like, and they're like LCSW or LM. I'm like,
There's so much power in acronyms, you know. I mean, the military found this out. I mean, we always joke as nurses that like a nurse will say, you know, RN, BSN, and then like a string of other things that just mean you took a class.
Yeah.
And you didn't enjoy it, but now you have some more things to put past your name.
Yeah.
And even for anesthetist, I'm not sure if you're supposed to put the MSN or the CRNA first, and they switch it every few years. So
I know for me, I'm like, why put MSW? Like, I have to have my master's to have an independent license. So like, that's obvious. Like, you know.
For sure. So anyways, we did a show already, but we had a little bit extra time. So we thought we'd talk a little bit about depression and what you can do for depression if you don't feel like taking pills. So obviously being a therapist, and the thing that we also have in common is, so you're a self-pay therapist and I'm a true practical nurse anesthetist. So neither of us are into this whole thing where you like sign up for a lifetime of mental health care. Like if that sounds tedious and you might as well just take pills and not come see us, whatever. It's more of the idea of like, okay, what can I do that's time limited in some cases, gets me somewhere, and then I can choose when I'm out of survival mode and can figure this out on my own.
Yeah, and where you're not, like where you're giving yourself skills for the future, like you're altering habits, you're altering lifestyle, you're adding supports in, you're making accommodations for yourself, right? Like you're not just looking, we were talking about this on the last one, right? We're not just looking for the next quick fix. Yeah. We're not just like, oh, Planet Fitness has a membership deal, so that's gonna be what I'm gonna do now for my health. Oh wait, oh look, the meal program sent me, or you know, like the, what am I trying to think? Like the Blue Apron or the, you know, they sent me a deal in the mail and that's gonna change my life. That'll help me eat healthier, right? Like we're always just jumping to the next thing, and it's like, let's start small. Because my clients will be like, yeah, so all right, I'm gonna meal prep every night, and then I'm gonna do that, and I'm like, whoa, like let's look at the schedule and say, what day out of the week is best to plan your meals? And then what is the next day to go shopping? Right. And then when is the best time to cut, clean, prep your food, right? Like we get these big lofty goals that are like, that's what's gonna change my life and make me happy. And I'm the person that's like, hold on, let's break that down because I want you to be successful. Right. Otherwise, you're just gonna burn out.
And part of it too is like right now we're in the most individualistic society ever known to man. Right. So even there's a lot of, I'm on X or Twitter too often, and there's a lot of that like, the woman should do all these things. And it's like, well, if you look 2 generations back when they're on their pioneer dresses or whatever, their sister-in-law, their sister, their church, they had a lot of community help because we just talked about collective trauma. And that's how they could do all the things. Right. Because it wasn't just them. When they were in need, somebody stepped in to help them out. So this idea that we as singular humans are responsible for all these things, and the other side of it where we end up with people saying like, I have no responsibility toward anyone. It's like, well, you didn't pave the sidewalk that you're walking on, your city did. Right. We all have responsibility to each other, and it doesn't have to be this like live or die by yourself type of thing.
Yeah, and we do better when we take care of each other, right? It literally takes a village, and I think it's not about depression at all, but you brought it up, like, you know, we're very individualistic, but we also have no third spaces. Do you know what a third space is?
No, I don't.
It's a place you can just be.
Okay.
It's a place you can just be. You don't have to live there, you don't have to work there. You can just be there, and you don't have to like patronize and spend money and engage in capitalism, right?
Oh, right.
There's not very many family-friendly places that you can just take your children with you, right? So like the parents that are trying to have it all and do it all without any community support, like where do they go? Where can they be, right? The library, the park, maybe, but we don't have a lot of those spaces that are there for collective support.
It might just be the library now, because even like a Starbucks, if you try to work at one now, you're like, oh, this is uncomfortable. This is no longer meant for me to lounge in.
Yes, yeah.
And buy 2 lattes an hour to like make up for it or whatever.
Yeah. But even just those 2 examples of like the man trying to like pull himself up by his bootstraps and be like, I don't need any help, I'll figure it out, I'll do my own meal prep, I'll do my own gym, like whatever it is to get out of this depression myself. That's very isolating, which adds to your depression. If you think about the new parent that's now home with their newborn all day, every day, and they don't have support from community, they don't have anyone saying, you're gonna be okay, we can do this together, I'll support you, that's very isolating, which adds to depression, right?
For sure.
Yeah.
Well, I think part of it too as mental health professionals is to make our clinics third spaces. Because I always tell people, yeah, just put your feet up, treat this like your own home.
Yeah.
In fact, often we'll have patients just come wander in if they're like, look, I'm really feeling really bad. I don't think I'm bad enough to go to the hospital, but I'm not good enough to stay home. Like I've told them, just come hang out with us for a little bit till you feel better.
Yeah.
I mean, it really only works if they live within 10 minutes, honestly.
Right.
But it's still an option. And you're right, because there's so few other places where you can just be whoever you are without some sort of mask. Because even in depression, there's the cost of that mask, meaning that it takes literal energy to put on this facade of I am a normal person, or even if you're neurodivergent, often it's the same thing, that you can decide, am I going to be normal today or am I going to be productive? Unfortunately, I can't do both.
Yes, my neurodivergent self did not think all the way through of doing 2 episodes with Nick and putting this mask on and then going to have a board meeting in a half hour.
Yeah.
But it's fine. We'll find the spoons and we'll get it done.
We'll get it done. It'll be fine. So the other thing I want to talk about for depression is, and this is more for my clinic of Ascend Health Center. So one of the meds we have is Spravato. Insurance will pay for it. It's half of the ketamine molecule. It's a nasal spray, so it's not an oral medication you take every day. And there's this new indication for monotherapy, which means that you don't have to be on an antidepressant at the same time. You do have to have failed 2 antidepressants first, which is reasonable because you end up staying at our clinic for 2 hours each session. It's not something we prescribe for you to take home. And who's willing to do that unless they've tried a couple things and it's failed? So I think that's perfectly reasonable. But it's nice that for someone who's sort of given up on meds where they just have terrible side effects, or there's kind of this bell curve with patients where most people, you give them a medicine, they feel better, it's the end of the story. But I feel that a lot of antidepressants, that kind of cut the tails off of it. So you don't feel really badly depressed, but you also don't feel joy. And I feel that's kind of cheating. Like you're not really living if you're just kind of existing.
Right.
I mean, we saw that with the opioid crisis a few years ago as a nurse anesthetist. I was like, nope, this isn't working. They do not have pain, but they are also on their couch 24/7. Like, I don't think we won this battle, guys.
Right.
So it's kind of similar.
Absolutely. Oh gosh, the opiate epidemic. Go back there. Yeah.
So if someone doesn't want to take medicine, what do you tell them? And again, some of this is you have to do a lot of things in combination. Depression is a very complex disease. Sometimes it's inflammation. Sometimes it's just serotonin. There's multiple ways you can get depressed, multiple ways to get out of being depressed. So what's kind of like your go-to along with the usual things of taking space for yourself, whether it's third space, second space, first space, and obviously talking to a therapist when you need it or whatnot.
Yeah, and it's so complex, Nick. Like it's such a simple question when you ask it, but it's so complex because you might come to your a therapist for an assessment and say, hey, I'm depressed. And I tried antidepressants and I didn't like them, with my doctor, my primary care or whatever. I'm not just gonna be like, oh yeah, you have depression, let's treat that. There's a lot of things we have to rule out, right? Like, so somebody might have gone their whole life being diagnosed with depression by their primary care or being told that's what it was, or maybe anxiety, but maybe they have undiagnosed ADHD.
Right.
Maybe they have some other underlying condition, medical, mental health. It's all medical. Health is health. Your brain is an organ too.
Right.
Your nervous system is there. But first we have to rule out, right? What else could this be? Whether it's physical, there could be external factors that are contributing to it. Like if you go to work every day and you are just being bogged down by like an abusive coworker or boss, right? Like you just have to think about all those contextual things that are coming into it before we're like, pathology, you have major depressive disorder, right?
Here's your stamp.
So a lot of it is like validating for people. Well, man, like if I had to experience what you're experiencing all day, every day, I'd kind of be depressed too, right? Like, so sometimes it's those kind of conversations and maybe figuring out if people have access to it, like how we can shift things in your life if it makes sense for you. If it is a true depression, I'm never going to tell someone not to take medication. If they choose to decide that they don't want to do that, then we have lots of other options. So of course we're going to do let's encourage you to do some behavior modifications. Let's encourage you to do one small task and then we'll build upon it, right? Like habit stacking. So if you're having a really, really, really hard time remembering to, I don't know, take a supplement that you think will help you, or go out for a walk in the morning, it's like habit stacking. Like we were just talking about, I think before the show got started, or maybe at the beginning, because time and space
that might have been that ADHD talk that we did when we talked about the habit stacking.
Yeah. So like instead of trying to like, I'm depressed, what can I do to magically fix all of it?
Right.
It's breaking it down into small steps and creating those habits. I love animals. So if my people have animals, I always encourage them to spend more time with them, especially if they have dogs.
And it's good practice to love and receive love, honestly.
Yeah, and there's a lot of research behind the human-animal bond and how beneficial it is for your not only mental health but your physical health. Like it reduces cortisol levels, it regulates your blood pressure and your heart rate, gives you better feelings of like positive mood and decreased depression and anxiety. And when you have a dog whining that they need to go outside, you can't just lay in bed. Like, I mean, I guess you could, but then you have to also clean up the messes, right? So like it's behavior activation too, because it's motivating you to get outside.
How is your puppy doing, by the way?
Oh yeah, it's a 5-month-old puppy, so he's great. No, he's awesome. He's like the best puppy we've ever had.
Oh, good.
His name is Kale. It was a whole little litter of vegetable babies. There was like green bean and I don't know. The whole litter was born at the rescue. So
that's great.
That's been love. He just wants to snuggle up on me and love. So, but also like when we're in that freeze response, really, because we have what fight, flight, freeze, and then there's some other ones, but we're not going to get into that today for the general public.
Right.
But depression really is kind of a freeze response. So we need some kind of activation because typically, like you'll probably relate to, I don't want to go, but I know I need to, right? So like once you get to the thing, like there's been times where like I'm feeling funky, I'm feeling depressed, I'm feeling unmotivated. I don't want to go to that hangout I scheduled with my friends. But once I'm there, I'm good and I feel better and I'm getting dopamine.
Right. And even the most impressive TMS, ketamine infusion, all that stuff that we do at Ascend, a lot of it still won't get you to want to go. The difference is that once you do go, you'll be like, oh yeah, this was a good idea. So, which I think is important because if you're giving someone so powerful that just obliterates the way they were, then it's almost like when we would give patients Geodon and it's like, you're not depressed. Well, okay, you're barely surviving, but so, sorry.
No, no, that makes sense for sure. Yeah. And then, you know, people obviously like control of your diet. What do you have control over your diet? I don't know. Depends like what type of food you're able to access, right? So that's like an equity issue there, but definitely diet, nutrition plays into your health. And then we talk about things like having that support system in place. Yes, you can come talk to a therapist and tell us all your deep, dark secrets, and we're here for it, and we want to know the tea. And you need accountability partners. Like, you need people in your life that you trust enough to say, I can't get out of my own damn head today. And they'll be like, hey, it's okay. We're going to be all right. Do you want me to come over and hang out on the couch with you and just vegetate? Like, you need somebody that you can say, I'm not okay to, and then not feel alone, not feel isolated, but then able to get that support.
And in our gig economy, you really need someone that you don't have to pay to do things for you.
Right.
Honestly, because like I took a $65 Uber trip to the airport the other day to go to this Spravato conference. I was like, huh. I mean, I did have people who were willing at that point, but I was like, no, this is going to be too much time out of your day. I'll just pay for it or whatever. But there's just something about the fact that like, in today's economy, we're also singular and we have to pay for every single little thing, that it's really important to sometimes get something and give something without any strings attached. Both of them are really important, kind of going back to that whole dog analogy of like just that human ability, like I'm doing this and I'm not getting anything for it and that's perfectly fine. It's a much healthier way to live.
And if you feel like you need to have like a give and take in a relationship, we can live in a barter system. Like, okay, you take me to the airport today and I'll pick up your kids from school next week, right? Like,
well, that's true too. So if it's very clearly defined, there's also something very wholesome about that.
Right.
Like I see Dr. McElrath in Fairlawn and she says like, no, eat that pizza and say to yourself, this is a bad food and I'm gonna eat it and I'm gonna enjoy it. And that's so much better than like, it's a vegetable, I deserve it, I was good, I was bad, or whatever other weird things. Because our brain will rationalize anything we tell it to rationalize. Like that's what that's how it do.
Yep.
But at
your
the same
body
time,
and your body will believe everything you say, right? So then all of your other systems in your body start to participate with that belief that you've created.
There's a famous study, I wrote about it in a book. So they gave these participants shakes, and one person they told, this is a diet shake, it's good for you. And they told someone else, oh, this is a decadent dessert shake. And when it was a decadent dessert shake, like the body produced ghrelin, like all of the things that the stomach itself produced in response to what's in the food changed based on what the brain told it was receiving. So all those systems that we think are completely separate from the brain, it's like, okay, I release pepsin because this is a protein. Here's the enzyme I release because of the carbohydrate. Nope. it's still controlled by what your brain thinks is happening.
Yep. And I'm trying to, like, my kid's 3, right? So I'm doing all these like basic lessons, right? So like, you know, he sees something on a show or reading a book and he's like, Mommy, what's that? Right? So like we're reading a book and it's like talking about the parts of your body and it's like, that's your brain. And I'm like, okay, buddy, what does your brain do? And he's like, it thinks. And I'm like, yeah, what else? And I'm like, it communicates to your body things that it needs to do, right? So like, if you think about that at like the most basic level, this is why we don't want you isolated. We don't want you stuck in those negative thoughts, because your body is going to believe everything that you're telling yourself. So if you just say, I'm not good enough, I'm a piece of crap, I'm not worth anything, I shouldn't, well, whatever those things are, your body is like, all right, well, we're just going to adjust our functioning. And that's where kind of chronic health, chronic disease comes from, right? So although you might be annoyed with your therapist for like wanting to do reframing your thoughts or self-affirmations, it really does matter because of what you tell yourself.
So Tame the Beast is a series on YouTube that's really good for pain. When I first started in 2019, we did a lot of chronic pain infusions with ketamine, lidocaine, Decadron, Toradol, like every single med that's non-opioid that you can use. And then over the years, I was like, the fewer medications I can give and the more I can get people to like buy into them controlling their pain, biofeedback, like the better off we are. And obviously it's like the less they have to see my face, which maybe it's not the appropriate way to do it, but for almost all my patients, I'm always like, what's the least amount of work that we need to do to get you the best? Because I feel that that's what we all think internally when we go to the doctor, like, how can I see you as as little as I need to? So it is important.
And chronic, like I was mentioning earlier before we started, chronic health and chronic pain absolutely co-occur with depression, anxiety, things like that, right? Like when you're in pain and it hurts to just do your daily tasks, then that can be really depressing. I remember years ago when I was still working as a behavioral health consultant in primary care offices, I would see a lot of those chronic health patients and chronic pain, and I suffer from chronic pain myself, which most people are like, what, you're so young, you look able-bodied, and it's invisible. It's called an invisible illness. And so when I would help people understand and try to like, that's where that therapeutic self-disclosure would come in sometimes, because I'm like, there's a barrier, like you're older than me, or you don't see how I can help you, so let me try to bring it a little closer. And I'd be like, you know, I've had some chronic pain too, and this is what's helpful for me. And I try to be like, breath work and mindfulness and the things that really can work. They're like, lady, my body's in chronic pain. What do you mean I'm going to sit here and do breath work? That's not going to do anything, right? But then for the people that were like, all right, I'm willing to try anything, they're like, wow, hold on. This weird tapping thing you taught me, I don't feel pain now for a little while, right? Like, where did that pain just dissipate to? Or I was doing Lisa's sound bowl therapy, and a certain sound wave, I don't know, frequency, whatever you call it, moved through my body. And as it was moving through my body, I felt no pain. And then it moved through and there was my pain again, right? So like, be open-minded to trying new things, because our brain, again, is wired for survival. So it's gonna tell you like, don't bother doing that thing, it's not gonna work. That's not gonna work either. We've tried that, nothing matters, right? Like so just be open-minded and just go with it. What is the Mel Robbins book, like the 5-second rule or something? Like if you have an idea and you're like, I wanna go for a walk, like just get off the couch, go put your shoes on. Like don't even allow yourself to think through it, because you will inevitably talk yourself out of it, because brain is like, oh, no. Survival, if we get up and walk right now, like that's too much exertion. We don't want to do that, right? Like keep you safe, but it can keep you too safe.
And it's a good way to trust your gut. So I'm a little cynical where I'm like, a lot of this, like follow your heart, follow your emotions, like it just feels good for the moment. You just followed some dopamine rush. But that's one example. It's like, well, no, as you learn to listen to yourself, then you're better prepared to answer questions. Because a lot of times I will tell patients like, no, you need to suck it up and try psychiatric medicine. So maybe not quite as therapeutic as you, with the idea of like, no, we want you to get off of everything, but start this, let's see if we can get the ball rolling, and then let's find a way to wean it. Because unless we have some sort of end game, then I'm signing up for a lifetime of an appointment at least every 3 months at a Ascend Health Center. Like, what's our end game here? But in some cases, like, well, everything you tried was related to serotonin. We need to try something with the glutamate, whether it's like the drug Alvality or ketamine infusion or Spravato, or something electrical like transcranial magnetic stimulation. But the idea of like, well, let's not try the same thing, but we can at least reach these low-hanging fruit, like try a med. Okay, now we can start talking about your thyroid, setting up with a functional medicine doctor, some of these more expensive or more detailed things, but we can at least try with some of the easy things. Because I feel that's what holistic means. Like a holistic way to treat depression doesn't mean here's an herb, see you in 2 weeks, don't eat any chemicals. It's like we've got this huge, we know that this is a complex disease, so we need a huge variety of ways to treat it, and each one of these ways we need to take it to completion, not like, oh, I tried that once. And there's very few things. Like I took a walk, it was 2023, the leaves were falling, maybe October, didn't work. Here I am still depressed. So it's a sort of like, well, how long do you need to try something before you can say that was a failure? And part of it too is like, well, what was the side effect of that failure? Like you had to buy running shoes a few weeks earlier, like that's okay, keep doing that thing. As opposed to like, I nausea for a month, like, okay, let's not try that again.
Weigh
It's
the
not
pros and
worth it.
cons, for sure,
So we have about a minute and a half left before you have to leave to go to your board meeting.
Yeah.
So what else do you want to say while we're here and all? So we're talking about depression, there's other things other than meds. I'm saying sometimes just try the med as long as you're with a provider who has an idea of like, okay, here's how we'll get you off of it in case it wastes your time. And a lot of it is financial. I mean, I talk about finances a lot because I feel everything in health should be viewed the same way as you do anything else in life. Like, there's something so empowering about, oh, this will make me feel better. Nope, not worth the money. I feel that's kind of kind to yourself instead of the like, I'm in survival mode, like throw the kitchen sink at me or whatever.
Yeah, and I think this is probably something I've said on a previous show, but I love like, listen to your body. A lot of us have been taught, you know, our parents did the best, most of them sometimes, but a lot of times they were like teaching us not to trust our bodies and not to listen to our bodies, right? Like, no, you need to stop eating, that's enough, or no, you don't, right? So like a lot of times it's like almost reparenting themselves, my clients, of like, it's okay, I can trust my body. So a lot of times when you're in those funks or when you're heading there, right? Like we're heading to the really deep depression funk, you'll have an idea like, oh, I should call someone, or oh, I need to move my body, I need to walk, or I need to, whatever it is, and don't ignore that. Go do that thing, right?
Absolutely. And sometimes there's spiritual issues too. Like, you know, being raised as a pastor's kid, a lot of it is like, okay, God will fix this, or I need to pray to God. But there's still plenty of room for your own insight. God wants a real relationship, not just some sort of robot who's like, oh, must pray, must do this. So no matter how you're raised or whatever belief system, there's so much room for like, what is your own intuition? You know, what wisdom have you gained from your faith practices? What wisdom have you gained from the way you've lived your life? And you need to start to trust that wisdom for sure.
Absolutely. So. What wisdom have you gained from the collective that you're supporting yourself with?
Absolutely.
Yeah.
Well, thanks for coming on for a second show then.
I'm here for it. We got to do this again soon.
Absolutely. And thank you all for watching as well.
You are watching WCTV, Wadsworth Community Television.